Welcome everyone to today's webinar. Today's webinar is on feminist mobilization in the context of COVID-19. My name is Nadia Ali and I'm the director of the Center for Middle East Studies here at Brown University. And it's my great pleasure to welcome you all. So today's event is part of a larger initiative focusing on the significance of gender and sexuality and increasing our understanding of the Middle East and its diasporas. It is also part of the attempt to de-exceptionalize the Middle East and look comparatively at issues. And so I'm very happy that today's event will be looking jointly with my colleagues and activists from Latin America and the Caribbean. So the whole idea of the event is to address the fact that feminists all over the world have responded to and mobilized to address the wide-ranging inequalities and forms of gender-based violence that have been exacerbated by the COVID-19 pandemic. And we know cross-culturally that women have been disproportionately affected in terms of unemployment, limited access to adequate healthcare, political marginalization, and also, unfortunately, increasing and intensified forms of gender-based violence. So what we want to do today is to discuss feminist mobilization and strategies at the time of COVID-19 in relation to Latin America, Caribbean, and the Middle East. And the idea is to look at specificities, but also similarities in feminist struggles during this very challenging period. And I'm very pleased to co-host today's event with my colleague, Patsy Lewis. Patsy is director of the Center for Latin American and Caribbean Studies, Clark's, here at Brown University. And prior to joining the Mozn Institute here at Brown, she was professor of regional integration and small states development at the University of the West Indies in Jamaica. Over to you, Patsy. You're muted.
Thank you, Nadia, for that introduction. Welcome to all of you who are joining us. We're very happy to have you. I am very excited to be partnering with the Center for Middle East Studies on this very important discussion. CLACS brings together faculty and students across Brown who work on Latin America and the Caribbean, and we're also very much engaged in the welfare of the Latinx and Caribbean diaspora communities in Rhode Island, especially in Providence. We are particularly interested in the effects of COVID in a region that already suffers from high levels of inequality, that already has high levels of violence against women. I'm sorry, I seem to have lost connectivity. And I'm just very happy that we're able to organize this event. And I want to introduce two of our panelists, if I may, Nadia. Okay. Before I go on to introduce the panelists, I also want to thank our collaborator from the Caribbean, the Latin American Caribbean Center located at the University of the West Indies, who very graciously helped us with this event, as well as the University of the West Indies COVID task force that Gabrielle Hosein, who is one of our guest speakers today, is a member of. Gabrielle Hosein is the head of the Institute for Gender and Development Studies, the IGDS, at the University of the West Indies, St. Augustine campus, that's in Trinidad. She has been engaged in Caribbean feminist organization for over 25 years. Her research includes masculinities, gender-based violence, and gender-responsive budgeting. Her column, Diary of a Mothering Worker, has been published weekly in a national newspaper since 2012. Thank you, Dr. Hosein, for agreeing to be part of this discussion today.
Thanks so much for having me on behalf of the IGDS, and it's so nice to see all of you here. Thanks so much, Patsy.
Thank you. I also want to welcome and introduce Dr. Betilde Muñoz-Pogossian, who is Director of the Department of Social Inclusion at the Organization of American States. For more than 15 years, she has led missions, programs, and projects, and conducted research on issues of democracy and elections, gender, equity, and social inclusion, among others. At the Department of Social Inclusion at the OAS, Dr. Muñoz-Pogossian leads work on the inclusion of populations in vulnerable situations and on the promotion of the full exercise of their human rights. She holds a PhD in political science from Florida International University, Miami, and a master's degree in international relations from the University of South Florida, Tampa. She's the author of various academic publications and opinion columns on issues of democracy, human rights, migration and refugees, gender equity and social inclusion, among others. We are very happy to welcome Dr. Muñoz-Pogossian, and we're very grateful that you're joining us. Thank you.
Thank you so much for the invitation. I'm very glad to be here with you.
شكرا للاستضافة وشكرا لوجودكم.
Yeah, and now it's my great pleasure to introduce to you Lena Abu Habib. Lena Abu Habib is currently the Senior Gender Advisor at the Asfari Institute for Civil Society and Citizenship at the American University of Beirut. She is chair of the Collective for Research and Training for Development Action and serves as a board member for Gender at Work. She's also the MENA Strategic Advisor for the Global Fund for Women. Lena is a member of the editorial board of the Gender and Development Journal published by Oxfam. And I'm very pleased that she is here with us. I mean, over the years, I've been reading and appreciating her work and activism a lot, which is also the case for the next speaker that I'm happy to introduce, Mozn Hassan. Mozn is an Egyptian feminist activist, and she's founder of Nazra for Feminist Studies. Mozn has received many awards, among them the Global Fund for Women's inaugural Charlotte Munch Human Rights Award in 2013. Mozn, Hassan, and Nazra were jointly awarded one of the Right Livelihood Awards, often called the Alternative Nobel Peace Prize in 2016, for asserting the equality and rights of women in circumstances where they are subject to ongoing violence, abuse, and discrimination. Mohsen also received the Han Dink Award for Peace, Rights, and Equality. Welcome, all of you. I'm very, very pleased that you're here with us. So I'm going to start ask you all a question that, of course, you know, is one of sort of the reasons we brought everyone together, which is to you know, address the question in how far COVID-19 has worsened already pre-existing inequalities. What is the actual impact of the pandemic on the situation in which you have been involved, in which you've been active? So just give us a sort of brief diagnostic. And maybe we start with Betilde. Maybe you want to kick us off?
Sure, thank you so much. And again, thank you very much to Brown University for the invitation to join this discussion, to Dr. Lewis for reaching out and thinking of the OAS and the Latin American perspective, which is great to also have it analyzing comparative perspective in terms of what is happening in other regions of the world. So regarding your question, and you know, in the interest of time so that we can have a very dynamic discussion, we have to start by saying that the Latin American region continues to be the most unequal region in the world. So, you know, structural inequalities already existed before the pandemic, and they have actually become worse, become aggravated with the arrival of the pandemic and all the aftermath, or let's say the consequences of the measures that various governments have been taking to contain the virus, to mitigate the effects of the virus. And this is also the case for Latin American women. Before the pandemic, again, there were a series of issues that or challenges to the exercise of their rights. that have only become worse with the pandemic. And there's many things that we could cover, but perhaps I want to point out to two that have been crucial and have been high in the agenda of women and feminist activists in the last year, let's say. First is the issue of gender violence. And the second one would be this unequal distribution in the use of the time for women, the care of the private sphere, that and the question of who's taking care of things at home now that everything is happening in the homes, right? So these two elements, I think, are top on the challenges that women are facing, and that have become sort of flagships for women's movements throughout the region. So alluding to this scourge that continues to plague the region, the social distancing, and really the confinement and isolation that have been required by some governments have created more challenges for women specifically who suffer from domestic violence, right? So the same measures that are supposed to help protect the health of people, in a way, have represented something completely different for hundreds of women who have found that to be almost a declaration of imminent risk, even to their physical integrity, but also to their own lives. We have data that shows that around 30% of women in the Americas have suffered physical or sexual violence from their partners, and around 38% of women are killed at the hands of their partners or ex or former partners. And going to work or participating in community activities, engaging outside of the home, was usually a escape valve from these aggressive situations, and now they have been confined to spending time with their aggressors 24/7. Of course, these are human stories. I don't want to just stay on statistics. We're talking about people here, women here, but I just want to quote an example. For instance, in the case of Argentina, the emergency telephone line, or the hotline from the Ministry of Justice and Human Rights that collects data and responds to requests for help from women on issues of domestic violence, register a 67% increase in calls from women. The case of Colombia and Chile are similar. We're talking about 39% and 70% increase in the number of calls from women who are subject to domestic violence. And if we see the region overall, we know also that our colleagues at the Inter-American Commission on Women have documented that overall at the regional level, the increase has been around 80%. So that's one point. And then the second one that I also wanted to bring to this discussion is the use of time, right? The unequal distribution in the use of time, especially in terms of the private, the care of the private. Before the pandemic, data from ECLAC told us that 30% of women spend 30% more of their time to care for the home, for the children, for the elderly, the people with disabilities. And again, this has been aggravated with the measures of social isolation and confinement that have been implemented to protect public health. We know, we were chatting right before the event started that everything is happening in the home. Education of the children and adolescents, formal labor to those of us who have a formal labor, the care of those who live with us. And unfortunately, instead of providing a collective and more equitable response to these new challenges that the COVID-19 pandemic brought, the brunt of the care of the private has fallen predominantly on women, with the additional caveat in the case of the Americas, that the work is not really valued, neither socially or financially. So this is a dimension that is putting a lot of pressure on the situation of women as a result of COVID. I think I would leave it at that. I mean, there's other dimensions of the impact of COVID-19 on women, and we follow up very closely, and this is something that I have a mandate to do at the department that I lead on migrant women. We see, specific challenges that women in human mobility patterns are facing due to COVID-19. We also have the whole dimension of economic and social rights, and specifically how, in the case of Latin America, where we have a predominant representation of women in the informal sector, and this has been one of the sectors hardest hit by the pandemic, we have, a series of other consequences of the pandemic on women. But in the interest of time, I would definitely map out those two as the crucial ones, and I'd be happy to hear what other regions are experiencing.
Yeah, well, thank you very much, Betilde. Before I'm going to ask Lena Abu Habib to follow up, and I mean, I can already, just listening to you, Betilde, see that there are parallels with the Middle East. I'd just like to tell our audience that we will be in conversation for a while, but then we very much encourage you to ask questions, and you can do so by putting your questions in the Q&A if you're following us via the webinar. If you're following us via YouTube, there's also the possibility for you to put the questions and they'll be fed to us. I just wanted to remind everyone. Lena, would you like to follow up, please?
Sure, and definitely, as you said, Nadia, there are so, what Betilde says bears so much resonance for the MENA region. But let me just go back a little bit and say, well, now, in real time, we're basically celebrating, not necessarily a happy celebration, but this is a one-year celebration of the pandemic. And also for the region, this is the first decade, the 10-year anniversary of the first wave of revolutions in the MENA region. And it's very difficult, if not impossible, to dissociate, kind of look at and analyze the impact of the pandemic while isolating it from, this journey in the region, these last 10 years. With the political instability, political repression, and also the severe economic downfall. So it's futile to just look or try to understand the impact of the pandemic on women, on particular groups, in isolation of these other factors. And because of this, what is our starting point if we want to look at the pandemic? Our starting point is throughout the region is actually dysfunctional regimes, oppressive regimes, militarized regimes where the social contract is seriously problematic, where the relationship with the state is incredibly problematic, where actually the whole concept of rights is almost inexistent, and where the relation of the women's relation with the state is mediated by religious family laws. And I want to start with this because this is where I want to emphasize what happened during the pandemic in a situation where everything is falling apart. So of course, as the pandemic hit, the different regimes in the region acted in exactly the same way they had acted before, which is basically they continued to infantilize people, oppress people, and militarize. This is exactly the kind of reaction. So rather than looking seriously at public policies, at social protection, at actually looking at the impact on women particularly, knowing very well from all of our previous experiences, and we're not talking about experiences that are far away in our history, but from contemporary experiences, that women are going to be affected way worse in terms of their vulnerability to violence, that inexistent services in such a situation are, is going to, it's going to exacerbate, and that the first to lose their jobs and the first to be expected to do everything at home would be women, from being the carers to being the nurses and the cleaners and everything that you think of. I have to stop here just to use an example from Lebanon because I think it's incredibly
أنا حابة إن
significant.
أنا أكون بستخدم مثال من لبنان على الكلام دوت.
Okay. And this example, we have
المثال دوت اللي إحنا عندنا من لبنان.
I think there's a problem with the translation, with the interpretation. Okay. So the person, the authority in charge of taking care of what needs to happen during the pandemic in Lebanon is the Minister of Interior, not the most democratic, not the most feminist, usually in any government. The Minister of Interior imposed a lockdown. The lockdown at first, because they, in our region, they change their mind every 24 hours. At first, the lockdown was imposed also in terms of services related to food and so on. When the minister was challenged, when he was told, why have you stopped food delivery? He said, it's okay if women are at home in any case, why don't they cook? This is beyond anecdotal. This is actually a mindset which views women as carers and their obligation to take care of everything during the pandemic. So what happened? Why? I just want to circle back, if I may, and please, Nadia, please tell me if I've exceeded my time.
Just one more minute, if it's okay. Yes.
I want to circle back to the issue of family laws and what happened during family laws. Our family laws are regulated by religious courts, which were not functioning during the pandemic. So the caseload of women in limbo, waiting for verdicts, pending their alimony, pending, recuperating their children or divorces, etc. All of this stopped functioning. And then when we get back to the discussion, I just want to talk a little bit about the feminist mobilization that actually addressed this rather than the state. So thank you, Nadia.
Thank you very much, Lena. Mohsen, I'm going to follow up with you because I know that you yourself and also Nazra, the organization you established, has been particularly focusing on the issue of gender-based violence. And I was wondering if you can tell us a bit more about that in terms of the impact of the pandemic, although there is, of course, a much wider context and history to it.
Yeah, thank you, Nadia, and thank you all really for this discussion. And I'm always thinking that one of the best things of being a feminist in such a time, that to have such a discussion between feminists, especially from our regions, because sometimes while you are living in this context daily, you feel like it's all in your head, that you are the only one who's thinking like this. But these discussions personally is helping my mental health and ability, and also our collective thinking. And following to what Lena has been saying, and it's always hard to speak after Lena Abu Habib, but I do think that it is really important to see also the context and having deepen the discussion about the context in our region, which we're not saying that it's better or worse, because while living in such a context, you would know that how worse it is. And I have one of my friends, she always has been telling me that it's easy in our region to be a researcher because people are speaking about gender inequalities and violence widely, but it's always hard to be an activist within this context, try to interfere. Thinking deeply about the last 10 years and how the pandemic is coming in a time that all this region has been really and dramatically changed in the last 10 years. Changed in the basic question about what is the public sphere. So this pandemic came in a time that the complication of the definition of the public sphere and other definitions of either violence, feminism, rights, and movements are more complicated and multi-layered. We have been facing for these years these thinkings and narratives about a real new public sphere. So it's not in our head that these regions, especially I'm speaking about these 10 years of my country and our work in our country in Egypt, that Egypt has been radically changed in the last 10 years. The definition of the public sphere, the entering of new people, fresh ideas, and another system of what is the definition of the usual suspect, and now there is no usual suspect. But at the same time, we have been in the last 10 years, harder in the last 6 years, that there is a message from different groups in our country telling us that it's not your space, and we will reshape the public sphere as we are defining it. And this is about the struggle, and because of that, it's not black or white, but the pandemic came in such a time that there is no public sphere in different countries in our region, and it is either by securitization, like what's happening in Egypt, and the second wave of different revolutions in different countries like Iraq, Lebanon, Sudan, or the consequences of being in a different public sphere, like what's happening now in Tunisia, which no one can deny that this is all about the last 10 years. So the pandemic came in this thing while violence became a big question for everyone. Violence as a societal violence, violence as maybe this is the language people have been speaking in the last 10 years between each other, seeing how the non-state violence has been increased. And you can see the gender situation as a basic definition of how people have been pressured in the last 10 years. So seeing how the sexual violence became something, because it doesn't mean that it wasn't before, but it means that how all these different dynamics, and also when we speak about mobilization, how the bodily rights, not only for women, but also for LGBTIQ plus people, and the body question has been something so big within this region. So the pandemic came while we are in closed public sphere, so people have been used the social media as alternative public sphere. So people have been dealing with the social media as if it is the new public sphere. State and regimes have been targeting people through the social media as if it was they were speaking up in different protests or events. In the last first 5 years of this decade, the people who have been targeting even socially or organized by state or non-state or different political groups on social media, it's like this violence we have been seeing for years. And what's happened, and also because we are a country in Egypt have been facing this sexual violence incident, the mob sexual assault and gang rape, and I think it changed the question of the body in our country on different levels, and also in our imagination as feminists, and also I think as a society. So and you couldn't see it out of the private sphere by any way, but it was the thing publicly that no one can deny it, that it happens. So the ways how
Mozan, sorry to interrupt. Do you think you can come? I would like to follow on.
Yeah.
Would you like to just conclude, or?
Yeah. I wanted just to end that, seeing the violence in the public sphere happening in the last 10 years, so you can see how things have been happening in the private sphere now, because the question and the definition of public and private has been so complicated in different years.
Yes, thank you. Yeah, I think that's, both Lina and Mohsen made it very clear that, we need to be very careful in terms of our analysis to not have a kind of snapshot view in terms of the situation just being influenced by the pandemic. I mean, clearly there are layers and there are specific impacts and consequences, but those take place within a much wider context. And so, Gabrielle, I'm now very interested to hear from you. I assume there's also quite a bit. I saw you nodding quite a bit that is resonating with your experiences. So can you tell us a little bit about the context that you're working in?
Thanks so much, Nadia. The Caribbean is a highly vulnerable region. One, very high levels of debt. Number two, a number of Caribbean islands have been severely affected by the climate crisis in the last few years. And as well, it is a region that is tourist dependent, and for countries like Trinidad and Tobago, dependent on oil and gas prices. And so it is a region highly connected to what's happening in the world political economy, and already experiencing severe vulnerabilities. And I just want to highlight some of them. So what we have found, and I'd like to just thank the staff and students of the Institute for Gender and Development Studies for some of the research that they've been doing over these past months. We have noted in interviews with women that there is not only a rise in their responsibilities around care of families, but that their responsibilities for care are also linked to a rise in joblessness, and a rise in joblessness is linked to a rise in economic dependence, and that their increased economic dependence is leading to the reinforcement of traditional gender roles in their relationships and in their families. So what we are seeing, what women are describing, about a little over 20 women were interviewed in Trinidad and Tobago about how they're experiencing COVID, and predominantly, maybe except for two, who had particular kinds of professional access and privileges, they reported an increase, a return to traditional gender roles that I want us to really put on the table, because we know the factors, right? The increased emphasis on care, not just for family, but extended family. We know that health systems have slowed down because of COVID. They're not taking as many patients in Trinidad and Tobago. Some surgeries have been delayed. It takes much longer to get appointments for your family in the public healthcare system. And so that support for family health, extended family health, is also falling on women now to an increased extent. We know that women's roles in the informal sector, the service industry, the retail industry have been severely affected. And we know that in their turn, also in their combined responsibilities for children, I think what stood out to me, and it sounds so obvious as a feminist, is the extent to which women felt a sense of depression and frustration and disappointment because of their loss of economic autonomy. You know, we talk about this all the time, the role that economic autonomy plays for women, but when you hear how women are experiencing it emotionally because they have lost this economic autonomy, are more dependent on male partners, and indeed are more domesticated now than ever before, you know, those show some of the ways that those factors are interconnecting. And that's what some of our data collection shows. In Trinidad and Tobago, for example, in 2019, there were 232 reports of domestic violence. In 2020, there were 558 reports of domestic violence. We were able to see a rise in both domestic violence and in femicide. The Children's Authority of Trinidad and Tobago also noted a rise in child sexual abuse and incest. One of the things we know is that children tend to be more likely to report when they're in school because teachers provide a safe service provider who may notice their symptoms and be able to disclose, may be able to report to the police and so on. So we know that what's happening in terms of very high rates of child sexual abuse in the Caribbean, we know that that is a part of the pandemic that we are not seeing because it is not reaching the service providers that it would have in the school system. And I want to kind of put this very squarely on the table because, of course, child sexual abuse predominantly affects girls and predominantly affects adolescent girls. One of the other things I just would like to mention in my few minutes is the question of the digital divide. And when we talk about how women's organizations will be responding a little bit on, you know, one of the things they said is how many women did not have access, computer access, did not have computer literacy that may have allowed them to take advantage of new economic opportunities provided by online shopping or, you know, online advertising and so on. In particular, rural women, women in agriculture and so on. And so the digital divide, which we know is a global issue, has direct implications for women's ability to find alternate livelihoods when they are now under greater lockdown conditions. The digital divide has also affected children. I suppose this is one of the last points that I can make here. The recent reports in Trinidad and Tobago are that up to 50,000 children have had no access to schooling online, either because they have not had sufficient connectivity or hardware or computers or digital devices have not had access. And for me, this is a lost generation that we are going to have to pay serious attention to in terms of an increase in girls' vulnerability, pregnancy, HIV, boys' turn to criminality and the illegal economy and so on over the next decade, which is, of course, an issue of care, of community resilience, of peace and peace building, and of a public policy that recognizes this. So I'll stop here for now.
Yeah, thank you very much, Gabrielle. Well, a lot to think about. I'm going to hand over to my colleague, Patsy Lewis, now to follow up. Patsy. You're muted.
I'm sorry. This is a fascinating discussion, and there are lots of questions that are emerging, such as how has the pandemic affected protests and resistance across, Latin America and the Middle East? How women have been mobilizing differently to address some of the challenges. But I wanted to ask, though, to kind of get a picture of that, we can hang on to. What has been the response? I get the impression that responses might have been different across countries and regions. I mean, we get a sense that in the Middle East, that the government, well, some governments have not been particularly responsive to women, and response fit very much into restrictions on women and how women are seen. But I'm not quite sure, for example, that's the same in the Caribbean and in Latin America. So I just wanted a general sense, if you can give us, of what has been the official response to COVID and the extent to which the official response has, our responses have taken account of women in any way and the challenges they face, and what you think, is missing, so that we can get a better sense for comparison.
Shall I start?
Sure. Yeah.
Okay. So yes, it's in terms of how, and I would say official responses as well as responses from feminist movements, from women's movements in Latin America that have, kind of created partnerships in terms of pushing responses that at least they consider three key principles. I mean, it's kind of like the constant, the common denominator in all the efforts by women's and feminist organizations. First, that the responses consider a rights-based approach. In other words, that the countries and governments and responses from all actors take into consideration the obligations that member states, at least in the case of the OAS, have acquired in terms of human rights, right? Sort of that they are aligned to inter-American juridical instruments that protect, people against discrimination, that, advocate for equality, and all the different principles that are central to the inter-American system of human rights: universality, interdependence, indivisibility of all rights, civil, political, as well as economic, social, and cultural rights. The second key principle that has also been at the center of this, or the demand, so that they are at the center of the responses, is the gender perspective, in the sense that the need to understand the differentiated impact that the COVID-19, the pandemic and the measures taken by governments is having on men and women differently. The need to include women in the conversation about how to respond to these challenges, and how to, sort of like a bigger picture type of thing, how to take advantage of this situation to address the structural inequalities, the inequality gaps that preceded the pandemic and continued during the pandemic and got aggravated. And the third principle, that is kind of like one of the demands by women's groups and with allies in government, has been making sure to consider the principle of intersectionality, right? And this understanding that we're not talking about a homogeneous group of women, that there's so much diversity within women in Latin America, and any response should take into consideration particular realities of women crossed by race, ethnicity, age, whether they live in rural or urban areas, whether they have access to internet or not, and a series of other factors. And in terms of strategies, I want to mention that the conversation in Latin America has been, of course, sort of mapping those two issues that I mentioned in my previous participation. How to address the persistence of gender violence against women, or violence against women, and the issue of the distribution of time. But there's also been a big strategy to push to have more women in the spaces where decisions are being made regarding the crisis, right? Most of Latin American countries governments have put together task forces or special ministerial groups to respond to the crisis. Well, there has been an important push by women's and feminist organizations to ensure that women are also participating of these spaces. Another key strategy has been to ensure that in most Latin American countries, we have ministries for women or an equivalent institutionality addressing the issue of the advancement and the protection of the rights of women. So how to ensure that these members of cabinets are present in each of the task forces, designing policies to respond to the COVID-19 crisis. Another factor, a third factor that I would mention is the women's groups, feminist groups have been sort of capitalizing on the good experiences of women as heads of state who have had a good performance in responding to the crisis, sort of to neutralize gender biases, or maybe perhaps pushing for a more positive evaluation of women's leadership abilities, sort of to normalize their presence. And finally, I would mention a fourth strategy, which is kind of like not sort of to push, not to regress, no, ni un paso atrás, as we say in Spanish, not one step backwards in terms of policies that have been approved to further women's rights. And here I want to just illustrate two very concrete examples. The approval in Chile of a constituent assembly process, right, during the pandemic. Women's groups, feminist groups managed to ensure that this constituent assembly responds to a parity principle, in the sense that 50% of the members of the new constituent assembly that will draft a new social contract in Chile will be women and 50% will be men. And then the second example that I also want to, I think, illustrates this push to not let any regressions happen is what recently happened in Argentina, where we just saw the legalization of abortion, based on important and very diverse grassroots movements by women and feminists that generated pressure enough to have this approved. And all of this happened in the context of the pandemic. So I think these are very interesting strategies that women in Latin America have used to ensure that their voices are heard and that their perspective is taken into consideration when it comes to responding to the COVID-19 crisis.
I'm sorry. Lina, would you like to go next? Thank you, Betilde.
Lina, you're muted.
Gosh, it's been a year and we never, it hasn't become natural that you unmute immediately. I don't know. I think in the case of the MENA region, I want to focus more in terms of the ways in which feminists mobilized and found solutions, simply because when you have regimes, and again, I insist on using the term regimes, when you have regimes who in any case, in the best case scenario, are discriminatory and actually fail women, they're not going to fare better during a pandemic. And imagine the case of Lebanon, revolution, pandemic, a major explosion and an economic downfall. So, our expectations are not so much. So, however, despite all these challenges, I think one of the things that I personally I'm keen on celebrating is the innovative ways in which feminists mobilized and addressed what otherwise could be construed as humongous challenges, all happening at the same time. I'm going to take a few examples, for instance, and I want to focus especially on the cases of Lebanon and Tunisia. In Tunisia, young feminist organizations, intersectional feminists, queer groups, etc., mobilized immediately because they recognized the ways in which sex workers have been affected by the pandemic. And the ways in which the queer community has been affected by the pandemic. And the ways in which they've been affected was by, first of all, losing livelihoods completely, and actually losing shelters and having a roof over your head. So it was an immediate mobilization, which used as a strategy the kind of trying to mobilize the private sector, at least in making sure that sexual and reproductive health issues are addressed, that shelter issues are addressed. Yes, you're going to say this is emergency relief, etc., but only the feminists were doing it vis-a-vis this particular population. The same was happening in Lebanon, and this makes me immensely proud to see young, nascent feminist organizations, LGBTQ groups, actually mobilizing literally from one day to the other to address, to make sure that they are able to support as many members of the queer community as possible, as many sex workers as possible, and also, the other invisible group, migrant workers. In the case of Lebanon, for instance, as a direct result of the pandemic and the economic crisis, and of course racism, our institutionalized racism, households were simply throwing migrant domestic workers on the street. The government didn't care. They don't fall under the remit of the Ministry of Labor, and certainly their honorary consulate didn't care. It was actually feminists mobilizing and putting together a huge program of repatriation so that women were not left on the streets. Another form of mobilization, which we've seen, Mozn and I are active in a regional setup, a regional network of feminist organizations in every single country, or most countries in the region. Feminist organizations made sure that the shelters for victims of domestic violence were immediately operational. In the case of Lebanon, in the case of Jordan, they set up on their own, and I want to insist, without government support, without the support of the state, measures that ensure safety and security, quarantine measures, etc. They actually lobbied where we have in our countries, where we have domestic violence bills. They actually they did two kinds of very successful, in an uneven way, but two successful kinds of lobbying. One in terms of digitizing court procedures, and by court, I want to go back to the religious court, because this is a microcosm on its own. So by digitizing court procedures, making sure that cases are heard on Skype, making sure that verdicts are made on Skype, so that women whose lives are in limbo can get some relief during that period. They lobbied law enforcement because where these laws exist, law enforcement has to be responsive in the case of domestic violence. In Lebanon, in 1 month alone, early in the pandemic, we had in April 2020, we had 6 women killed in their household. 6 women in 1 month. And it was actually these cases which prompted feminist organization to work, to lobby, to insist that law enforcement does its job as per the law that we have. So in a sense, what we have yet to do, I think, is to reflect ourselves in our region, think about how can we give due justice to all these kinds of mobilizations which have taken place with very little resources and within very challenging contexts, within oppressive regimes, within situations of political instability, plus COVID on top. I just have one kind of tangential point in terms of the lack of any form of initiative or policy or even thinking that takes into consideration the impact of the pandemic on women from the part of the regimes. For instance, the issue of homeschooling. Most of our countries have shifted into homeschooling. Never mind that internet penetration is uneven. Never mind that it's not going to be possible in the same way for rich and poor, rural and urban, etc. Never mind all of this, but actually homeschooling fell entirely within as a responsibility of women in the household. And especially, for instance, women who had themselves had to maintain their jobs, their precarious jobs. So there was not even a question as to how does homeschooling happen? Does it happen on its own? Of course it doesn't. Who ultimately is in charge? And it really reminded me of when we used to talk in the 80s, because I'm from that generation, in terms of structural adjustment and who is going to bear the responsibility of the state retrenching from, so what happens when as a patient you can stay in a hospital just 2 days instead of 10? There's a woman whose labor is free who's going to take care of you. What happens when a class in a public school, when the class moves from 20 kids to 45 kids, somebody has to pick up the pieces. Exactly the same pattern repeated itself. Thank you.
Sorry, again, Mozn. Thank you, Lena.
Yeah, can't agree with Lena more that I really think that I'm so proud that I'm part of this movement in our region, and honestly in Egypt based on different things. But sometimes Lena, I think, more optimistic than me. I think we need to see what we mean by mobilization within all these contexts. And what do we mean by responses? Because by 10 years of mobilization, I do think that we as feminists need more than being appreciated for just being mobilized. And this is something we need to think more about. What do we mean by responses? We are in a region which some of the regimes which still existing in a way, because we have almost half of this region, we don't have regime, we don't have a collective state, if we can say, They are saying all the time good words about women, so there is this responses by papers, by some policies, by speaking up internationally about how they are responding to what's happening to the COVID. And for me, all of these things are big words, because also seeing responses to the pandemic as if it's ending, while we are in a context which no transparency what's happening in this region within this pandemic, especially for women and other groups which most of these societies, not only the state or the regimes, don't consider prostitutes as citizens or existing. And we have countries mainly saying that LGBTIQ people are not existing in our region. So it's so complicated, but yes, there are different good examples like Lina has been saying, but at the same time, we need to look back that it's not only mobilization is not a goal by itself. It is a way to achieve something. And sometimes I'm really afraid, maybe I'm so nostalgic after 10 years of the revolution, that it's hard that all the time, if we want to gain small things, we have to pay all these prices, and as if we are sacrificing all those survivals for some people to just say that we are existing. And sometimes I feel that it's not the role of the feminist movement to celebrate more survivals. And we need to be tougher on ourselves, that we are a movement which doesn't have any back, that we have regimes which don't like us in different strategic thing, that they are so patriarchal to understand that we are strong enough to mobilize and speaking up about what we are wanting, and they are targeting us. They are targeting us in different ways. We have different political groups, either by the faith-based or the violent groups, which we couldn't ignore how they are affecting this region in different ways, and also so-called the civic groups, how they don't see us as priority for their discussion now, while they are saying big things. So we are mobilizing by ourselves, and we have all the time international community questioning our existence, that you are not real, you are not speaking about the real people in your country, you are so bourgeois. So it's really hard to see all these scattered things as this is a goal. I think we need to stop and asking and demanding for more clear rights and spaces to mobilize and see for the first time some of the effects of it. So yes, I'm coming from a country which has everything hard in it, but we have those different young women and fresh women speaking up about sexual violence, even with well-known people in their communities. And this is something so making me, as a person who has been organizing in this issue for more than 15 years, not only happy or proud but relieved, but at the same time how those women have been treated in their country, in the legal system, and in other places. See how we were happy with what happened, and how the Sudanese women give this in different ways and perspectives about so-called those who are under Islamic place, and so one of the questions speaking about the mental health of, I think the mental health and the healing of the society is something so important, but also our movement should heal to be able to help others to heal. So all of these things make me thinking that the mobilization is going on, but we couldn't be asked all the time to mobilize by ourselves, just for people to say that yes, there is a movement in this region. So it's more complicated for me, and maybe I'm so nostalgic after 10 years thinking about mobilization in different ways.
Thank you, Mozn. We're also seeing mobilization, women who are also facing the challenges of COVID, increased care, probably women who have been losing jobs, also being at the forefront of mobilizing. So it's like, a double burden. Gabrielle, final comments. I think we're going to come to questions after this, Nadia. Okay. Yeah.
So, Patsy, I really appreciate the analogy with structural adjustment programs in the 1980s and the impact that those had on grassroots communities, and particularly on women, and the role of the women's movement in continuing to highlight that those approaches, those highly economistic approaches, were actually hiding the level of harm that women were navigating, their families, their communities were navigating, and the role that women and women's organizations played. And in fact, one of the research projects that we had hoped to undertake and still do is in fact to make that analogy, about the way that these two moments in many ways are a return to a particular kind of decision making and invisibility of its effects on the ground. In particular, in Trinidad and Tobago, the recovery committee that produced the recovery report for COVID-19 had 22 members, of which 3 of them were women, of which one of whom was the secretary of the committee and was a state official. There were no women's organizations represented on this committee. The one representative of civil society was a men's rights group that was said to represent everyone, an explicit men's rights group. And we, as the women's movement, we challenged that and said, well, you know, this is exactly what they're saying at a UN level, that women are being cut out of decision making because this is a language of a war in which women have responsibility for picking up the pieces, but not for directing what the governments, you know, should be doing, and not sitting at the table where those decisions are made. And so that very much has characterized the Trinidad and Tobago response, combined with an approach that thinks about women from a very WID framework in terms of welfare provision, motherhood, responsibility to family. So you have this, I mean, that it was like this all along, in a sense. You know, we never, in many ways, we never left the WID framework of addressing women in terms of welfare primarily. You know, we continue to try to challenge the patriarchal system in terms with, with approaches that involve gender mainstreaming, but we're constantly hitting a wall. And in the context of this being a war, this being a pandemic, this not being a social, economic, and political issue in which women are inevitably going to be affected in unequal ways, and therefore need to sit at the table, none of that has been factored largely across the region. There are a few exceptions. So Prime Minister Mia Mottley of Barbados is very successful, has been seen as an icon of caring leadership. But again, Barbados is a highly tourist-dependent economy, as is Jamaica. And both economies opened up very early because they needed to, they chose economic survival of tourist-dependent economies over some of the ways that the other governments, like the Trinidad and Tobago government, have taken a much more health-centered approach. And now Barbados is going again into a lockdown in which people may not be able to shop for some weeks, they may not be able to go out, they may be under curfew, and all of this speaks to an ongoing dependence of the region. And the way that, as you're saying, it's not simply that this is a COVID experience now. This is going to be a long, a period of 5 or more years in which these economies are not going to be able to recover in the ways that they were reliant on before. And that is something that I think, as women, as feminists, we need to make sure that we are pointing out, that you cannot go back to business as usual, because business as usual is not going, it was already not functioning. It was functioning in unequal ways, but it cannot be a resort right now for so many countries in the region. So my argument would be that women have in fact been excluded. Feminists have been excluded from the decision-making in relation to COVID. In Trinidad and Tobago, when we raised it, the public reaction was, well, there were not enough qualified women. But in the Caribbean, women have, women have been 60% of the university graduates for at least 20 years. Qualifications is not an issue here. It is absolutely a way that masculinist decision-making is determining our approach to economic recovery. In the context of that, we also have to pay attention to what is happening with a number of highly vulnerable populations, migrants. So migrants, for example, the Venezuelan crisis has affected Trinidad and Tobago. Migrant persons have come into an economy that is unstable, informal. There's a lot of narco politics that goes on, and a lot of trafficking. So the trafficking of persons, women and girls, has become an issue has risen as an issue in COVID, but not just because of what is happening in, for example, Trinidad and Tobago, but because of what is happening in neighboring countries like Venezuela, which is then affecting their neighbors, Guyana, Trinidad, and so on. And so having a migrant policy that is just and human rights focused and so on, which is very necessary. The IGDS has just been doing some work in the Bahamas, in Abaco, which was severely affected by the hurricane, and in which there were migrants from Haiti who have never recovered. They were undocumented to begin with. They were highly stigmatized as a group, and they remain ever more vulnerable, including migrant children. So, the approach to COVID decision-making and recovery not only excludes women in the sense of their typical roles as mothers, or the reliance on them to hold families together as if that is women's responsibility. But while there's state invisibility, it also speaks to the way that migrant populations, LGBTI populations, and also sex workers have, and the specific experiences and vulnerabilities of those groups are not factored in. So for example, CAISO, which is an organization that works for sex and gender justice in Trinidad and Tobago and is led by one of my colleagues at the IGDS, Dr. Angelique Nixon, did do a lot of emergency response with sex workers as well as with trans persons who were, now not able to access an income, a home, or even health care. One last point that I think it's important to make in this context is that not only are we at the table, we are not at the table as feminists around the region, and that is a fact. Feminists, however, have been mobilizing, and I love what Mozn had to say, which is that feminists are doing the work of holding communities together, of continuing to do advocacy, including successful passage, for example, of domestic violence legislation, where a lot of work went into that, advocacy on reproductive rights for adolescents and so on. But we cannot romanticize we have to be very clear about the extent to which that work is happening in conditions in which there's a greater intolerance to hearing it, because it is not fitting what seems to be a very clear health and economic agenda, in which the social and its complexity and its intersectionalities are getting left out. That said, to highlight some of the work on the ground, for example, women's group, the Cashew Gardens Community Council in Trinidad, which used to have a homework center, managed to get computers to the children who were not able to come to the center and support them in doing it, and were also able to start a climate smart garden with the support of some other organizations that then allow that garden to become an alternative source of livelihood. The CEDAW Committee of Trinidad and Tobago was able to use online platforms to enable women political candidates to speak to potential voters in alignment with Article 7 of the CEDAW Convention. And so for me, women are responding. They will talk about dealing with victims that are looking for emergency care. They will talk about homelessness, joblessness, and so on. And the extent to which their work has moved from advocacy and trying to transform this, the system, which is so much of what we do, to basic emergency care. And yet at the same time, they are indeed shifting to make the most of whatever opportunities are around at this time, but not in a way that I think we should be very realistic about, in terms of how it will contain our transformative possibilities over the next 5 to 10 years in the region.
I'm sorry, muted again. Thank you, Gabrielle, and thank you to our panelists for their responses. Nadia, would you like to?
Sure, yeah, I mean, thank you all. So interesting. I mean, I have to say, I guess there's so many questions. I'm going to now pay some attention to the audience questions, but before I do that, I mean, I guess, Gabi, when you say that, feminists have not been sitting around the table, I guess one big question for everyone is, do we want to sit around that table? Or, do we need to create another table? And I know that in the context of the Middle East, we actually don't want to sit on that table. I mean, the table is a problem. And I do suspect that there are differences in the relationship to the state and non-state actors, and the question of allies, both nationally, locally, but also transnationally, I think is an important question. I mean, the other point that really sort of emerges listening to you all, we started out introducing the event as, the specific impact on women, but clearly our analysis and our activism has to be intersectional. That is, so obvious. So we're speaking about class, we're speaking about, sexuality, we're speaking about ethnicity. I mean, we know that, racism very much intersects with sexism and patriarchy. We know that homophobia and transphobia, are very much an issue. And that maybe is a good point to connect with some of the questions of the audience. So there is a question by Gabi Gonzalez, for example, what are some of the current examples of efforts by governments or local organizations to help trans and queer women in this pandemic in the Caribbean, Central America, and the MENA region? Another question, we've heard about migrant women in different contexts, and clearly migrant women as well as trafficked women, and of course also queer and trans people have been very vulnerable during the pandemic. So if you would like to address this. So I'm going to just read out a few questions, and please, you won't be able to answer all of them, but those that you think, might resonate most with the work that you're doing. There's also a question here about masculinity and mental health. So I think, the issue of masculinity, what are, different ways in which, the pandemic and wider context have impacted on prevailing hegemonic masculinities, but also maybe alternative forms of masculinities. The issue of mental health has been raised by the audience. Some of you have mentioned mental health already. Clearly, this is sort of a pandemic within a pandemic globally. How is that playing out? What is done, if at all? I mean, I know, for instance, in the context of Iraq, I mean, prior to COVID-19, as a result of multiple wars, invasion, occupation, you have like a whole population that is, traumatized, and, you can't speak of a post-traumatic stress syndrome because there's like one trauma after another. So what happens when on top of that, you have a pandemic? So I think I'll leave it at that. And, we have just about 15 minutes. So if I could ask you all to just sort of for 3 minutes or so address any of the questions that speak specifically to the work that you're doing, the activism that you're doing. And maybe this time start with Gabrielle to just shuffle things around.
Thanks so much. So governments in the region are not intersecting gender and sexual diversity or recognition of the extent to which sex workers are particularly vulnerable, sex workers across sex, gender, and sexuality, into their responses as a government. And actually, I want to deal with the question of just being at the table for a second. We want to be at the table, we want to be next to the table, we want to be protesting the table, we want to be everywhere. And that is because the decisions that are being made about budgets and about the economic recovery are so gendered, are so gender blind, are so masculinist. So if we are going to take an approach to the recovery that's going to focus on stimulating the construction sector, but the construction sector is 80% male, then we know that we're putting money in the hands of men, in which women's economic dependence is going to make them more vulnerable to violence. And that's the kind of decision making. That's the budget. That's what's in the national budgets. That's what's in the recovery plan. And so I think we do want to be at the table. We do want to be heard. At the same time, we want to maintain our critical voice, and we want to maintain the power of our movements and our organizations on the ground as well. And in fact, in the Caribbean, there's long been a close relationship between civil society and state working together. We're small societies, so we often know each other across these kinds of divisions. In relation to mental health, I think the mental health issues are indeed beginning. We saw them, for example, in terms of the rise in violence that women were experiencing as a result of men's mental health responses. Whether it's to staying at home, which is a major issue for men in the Caribbean, or in terms of becoming primary breadwinners and the kinds of frustrations that led to in terms of their ability to cope. However, I think what we're seeing now in the Caribbean is a public health approach coming up against a mental health response, such that the people are beginning to wear thin on the public health, what's necessary at the level of public health, and are beginning to look after their mental health in ways that may not be either healthy for the public health response, or that are in ways that are that are the best ways for them. And I think that's going to be a growing issue for us, is the way that the people are going to respond to their public health needs, and in the way the governments have not been speaking to that in their health response primarily. I do want to say one other thing, which is that women's organizations on the ground, and I do just want to, and I mentioned the Cashew Gardens Community Council, I mentioned the CEDAW Committee of Trinidad and Tobago, for example, and the particular vulnerability of rural women around the digital divide, and the particular ways that the women's movement has sought to respond. But there's an important point about being on the table as well, which is that governments call on the women's movement to respond, in the old ways that the women's movement would be the implementation arm of a government strategy, and so being seen as that implementation arm, but not having the resources or the support or the right to participate in decision making at the same time, is how I think governments are going to attempt to roll out a COVID response, which is in conjunction with women's organizations, and yet treating them as if they are an unwaged and yet available care force to allow the government to reach places that it needs to, but which it can't, but without the necessary resources to allow the women's movement to do the work it has to do in response, to challenge the government at the same time.
Thank you, Gabrielle. Mozn, would you like to come in here?
Yeah, I think it's important to see what you, Nadia, have been saying about the table and who wants to be in the table or not in our region as something so important while we are analyzing the last 10 years of the feminist movement in our region. And I had this deep discussion with Lina yesterday about this, in another context, that sometimes I think the definition of the table is also relating to what those people have been seeing us and how we have been seeing us as a political movement. Because I do believe that feminist movement is a political movement. And in the last 10 years, I think some of the mobilization which affected in different ways and have different waves in this region, that we didn't seek this alternative role in our societies. We try to be within the mainstream. And I think this is also about how we can define the table. So maybe the table couldn't be with militarized, securitized groups, but at the same time, if people are creating other tables and they have the rights to stay on it and speak and have this mansplaining about us, we have to ask for our places for the table, because sometimes they are, I think, in a political way, they are bargaining, and sometimes they are intimidating us that, you want to be a state feminist, and all the time we are saying that, no, we don't want, but we are political feminists. So we need to have this public sphere to create our tools to see how we can affect the table with our rules, not with those, and speaking about masculinity, with this fragile masculinity, which is mainly constructed in our region and so presented within state and many political group people, that you are within this society, you have many people who are really fragile, that they have lots and excessive power, but at the same time, they don't get it most of the time. They don't get it. They're using it in the way that they are putting us on this position that we have, as if we are the people they can express their power on. And because of that, I'm always seeing the mobilization and seeing the movement with the scale of violence, see how we have been pressured from different groups, how the state and the regimes have been pressuring the feminist groups, the trans people, the LGBTIQ. This society, in our society, has been pressuring the LGBTIQ groups and people by jailing them and also putting them into this stigma until one of us has committed suicide. So this is the context we are going through it, and I think we have to see and analyze the table from this perspective, because honestly, in this almost failed states, there is no table. It is, but at the same time, if the table is the goal to have our voices, no, we have the right to create our ways, and you will not choose by yourselves your ways for us to exist. And this is what makes unpopular opinion our movement is not a failed movement in this region, that we have been trying to see our tables in different ways. The mobilization has been happening around the question of peace or violence in Iraq or in Yemen. This is about those women have been thinking about the power and the table in their ways, and they have been pushed back because they are women, not for any other political groups. Sometimes I think it's important in this wave of our movement in the region to not to be intimidated that someone is choosing our destiny or they are putting us in these stereotypes. We really achieved many things out of stereotypes, and also we are paying lots of prices out of it. Thank you.
Thank you very much, Mozn. Lina, over to you.
I think the conversation around which table is very interesting, and I certainly agree with a lot of things that most of the things, or actually that Mozn said. So I'm not going to talk much about it. Just to say that if we look back at our own feminist activism, at least those of us who have racked up years to look and are able to look back like 2-3 decades ago, and we see that we have been trying and testing different ways of engagement, and we have been at least many of us, we have been in this incredibly positive perspective, like, the regime is not homogeneous, that there are entry points. And of course, this is a completely different situation than the Caribbeans, that you can influence, that there's the inside, outside kind of activism and advocacy. And Nadia, now in 2021, and this is my own position and nobody else's, I think this is rubbish. This is utter rubbish. Most of the people in power, most of the regimes in power, it's a combination of the corrupt, the military, and the religious. Do we want to engage with them? I really doubt it. Is there any point of engaging with them? Again, now I long for the days of state feminism. At least there was a kind of a pretense of somebody you can talk with. We're past this. And I think this is where I think our mobilization as feminist mobilization within countries, across countries, within regions and cross regions, this is our asset. This is our fallback position. This is where we get our again, I speak for myself, this is where we get our kind of energy, inspiration, courage. Sorry, it does sound like an old feminist, but that solidarity for me is incredibly important, but also the space for the debate. being able to discuss, just stopping and being able to discuss what is happening during the pandemic. And eventually you're going to find that, you're the only one who's doing something about it, not as a person, as a movement, and you're out there. And I think the important point, and I will finish now, I think the important point for feminists in the region at this stage is not to be defeated, is actually to hold the fort, is to push back, is actually to hold our space and to broaden our space. And yes, I'm the eternal optimist, because I do see a younger generation of feminists organizing, which gives a lot of hope, because because on the one hand, yes, you have this amazing push of conservatives and anti everything related to rights, but at the same time, there's a coming together of a beautiful, gosh, now I sound like a romantic, Gabrielle, a beautiful kind of new, enthusiastic feminist voices, which, I mean, for me, this is, how do we nurture this? How do we keep connected? How can we manage not to despair? And I think we're doing a pretty good job at it. I mean, just one last thing, Nadia. I mean, with everything that the patriarchy has deployed against us, and also at the risk of sounding incredibly deja vu, but we're still standing. And despite everything, despite being really outnumbered, out-resourced, over-resourced, violence, repression, our comrades and colleagues in jails, our comrades on the street being actually patriarchal and sexual harassers, but we are still standing. And I think one of the ways which is nurturing for many of us, like Mozn has said, are actually these conversations that we're having.
Thank you, Lina. Yeah, and I mean, I want to bring in just what I found really instructive, how my colleague and former supervisor, Denise Candiotti, actually characterizes the moment, by saying, well, actually, one reason we are seeing so much violence and gender-based violence, even more so than before, is because patriarchy, as usual, is not sustaining itself anymore. I mean, we have made so many inroads. And so she's speaking of this masculinist restoration, the kind of the backlash, the militarized, the sort of, very, very intense gender-based and sexual violence. It's not because patriarchy feels at ease. It's because patriarchy does feel threatened. And I thought that is a good description of the current moment. Betilde, what would you like to add to this discussion?
Very briefly, because I adhere to what most of the colleagues who spoke before me mentioned. And again, I also enjoy very much that analogy of the table, right? And I have to agree with Gabrielle on this, at least for the Latin American region. We want to be sitting at the table. We want to have our voices heard. We want to be also part of those who are making the final decisions. And, it's kind of been at the forefront of a lot of at least the research that I do on women and politics, but also the activism that is happening throughout the region to ensure that women are included in quotas, in the list via quotas, or now the last push, the more recent push for parity in representation, right? So I call that the mother of all challenges that women's issues and women's rights and feminists have, which is ensuring that representation. I would mention something on the issue of masculinity and perhaps map out a second challenge to this work. You also mentioned it, Lina and Nadia, to this pushback, right? We are kind of moving the basis of patriarchy, fortunately, and making very nice inroads. And the natural consequence is the pushback. And beyond the ones I have already mentioned, I will speak about this issue happening in Latin America, which is a huge campaign of misinformation on a so-called gender ideology, right? This idea that when you are advocating for women's rights, you know, for feminism in the sense that we want women and men to have the same rights, you are just pushing an ideology that what it wants to do is destroy the family, destroy society. Oh my God, the world is gonna end, right? So, but you know, you would think that this is simple, but it's having very concrete consequences in terms of the political conversation, as well as some things as concrete as the funding that these organizations can have access to because of this demonization. And, you know, social media is also playing a role here in terms of generating fake information. And of course, what's behind is these patriarchal forces, religious in nature, often too, that do not want new inroads on the part of these feminist and women's movements. So just to mention those couple of comments that I think complement very well what my colleagues have said.
Well, thank you very much. I'm now going to, well, first, thank you all, and then hand over to Patsy to close the event. Unfortunately, we've run out of time, and apologies to all of you who've posted questions and we were not able to address them. Patsy?
Thank you very much to all of you. I found this discussion fascinating. Bringing these different regions and experiences together is really worthwhile. It's clear that there are a range of issues that women experience across these different regions, but the ways in which and the pathways that are open to addressing them are sometimes very different. And I would like a conversation about what it means to mobilize outside of the table, not being part of the table and outside of the existing systems, and, you know, how you motivate change in that way. And, you know, a comparison with other countries where what are the possibilities for actually engaging and moving the needle on women's issues. But this is fascinating. We should do this more often, this kind of collaboration. And I'm very thankful to the audience who came. At one point, it was close to 150 of you, 90 of you stayed right to the bitter end, and we're grateful for that. And I'm particularly thankful to Betilde, Lina, Mozn, and Gabrielle for joining us today. And to Nadia for collaborating, for allowing us to collaborate on this.
Thank you.
Barbara and Kate and John, and all of our colleagues behind the scenes who are not interpreters, who have really made this event go smoothly. Thank you all.
Yeah. Thank you. Bye, everyone.
Bye.
Bye. Thanks a lot.